Good afternoon, a very warm welcome wherever you're joining us from. If you're tuning in from around the world, welcome. If you're catching up, welcome. And crucially, if you're here in London at the O2 here in Greenwich, a very warm welcome to you. I'm Oli Barrett. I'm one of the official presenters here at CogX, but crucially, and this was my special request this year, the 7th year of CogX, I wanted to be on this stage. Why? Because it's about our guests' questions. So I get to have a chat with some amazing guests, but then it really is over to you. We're talking all things health, well-being, and tech as well. Our guest for this session is at least a triple threat guest. He's a physician, he's a scientist, he's an innovator, and he is an entrepreneur. He's the founder and partner at NextMed Health and Continuum Health Ventures. Funnily enough, his latest venture I'm going to quiz him about is in telemedicine. So we'll hear lots more about that. But please give a huge CogX welcome to Daniel Kraft. Good to see you, Daniel. Welcome.
Thanks so much.
Thank you for being with us here at CogX. I have spied you. We've sort of crossed paths in the corridors of this massive venue. So I get to say, what have you made of it so far? What dots have you been joining as you've woven your way around?
Yeah, well, it's been wonderful. First of all, I was born in London, so it's great to come back here. I can put on my fake British accent. But I've seen friends from California, like Megan Smith, who I've known for years, to Reid Hoffman, to Tristan Harris. And what's magical to think about CogX is it's this convergence of great entrepreneurs, innovators, startups, investors, thinking about the future and from different angles. Because I think the future, whether it's health, medicine, AI, robotics, it's all coming together in exciting ways. And I love the theme of getting the next 10 years right, because it's a huge challenge.
Yeah, there's so much goodwill, so much camaraderie. Any advice on having the difficult conversations? Because not everyone will see eye to eye about all things. I struggle myself to have those crunchier, pithier chats.
Well, I mean, sometimes British are very polite, and Americans, or New Yorkers at least, we're more direct. I think it is fun to sort of challenge people with what their assumptions are, whether it's about the future of technology or the ethics of gene editing, all the way to how do we imagine the energy of the future. So it's good to mix it up here in that way.
Yeah, so permission to do that a little bit more today. Now, some of our guests will have caught your words on the main stage yesterday. Not everybody. Give us the edited highlights of your message.
Well, the edited highlights are, there's been the theme of AI, or accelerating technologies. And from my lens, I look at, I'm a traditional physician scientist type, but the future of medicine could be built on all these accelerating platforms. It's not about just AI or blockchain or robotics or genomics or big data or wearables. It's how we mash them up to sort of rethink and reimagine healthcare, not just the sort of sick care side we're used to, but sort of the prevention, wellness, and health span and longevity realm. And I think we have that sort of opportunity, whether it's generative AI, or I like to think about it as generative health, to build the personalized digital twins to give us engagement in our self-care, whether it's understanding our genomics or our digital exhaust, and to use that for optimizing prevention, earlier diagnostics and therapy, and ultimately to start to democratize health and medicine around the planet.
Well, it's an immensely enticing promise, and I want to give you full permission to think of the positive uplands, sunlit uplands and all that. Give us a taste of what your latest work is about. Where's it taking you?
Well, I've run for several years a program looking at the future of healthcare. Shared medicine, something called Singularity University. I run a program called NextMed Health. What I like to do is often put together, the patients, the physicians, the startups, the often entrepreneurs coming from outside healthcare, video gamers, blockchain experts, to think about solving sometimes their own healthcare problems. Sometimes the most enticing problems are being solved for people outside of healthcare. And I like to look at pain points. And now we have these new tools that didn't exist when I was a Stanford medical student, from computational biology to ChatGPT to low-cost genomics to robotic surgery. And we can mash those up to solve our grand challenges in healthcare. So some of the things I'm up to are looking at this new world of digital health. I'll have some wearables or otherables, but it's not yet always translating to the clinician and the workflow. So I've been building a platform called digital.health and others in this telemedicine platform we can discuss to kind of help bring the technology of today to clinicians and patients so we don't need to wait for the future.
So paint me a picture of the solution. What does it look like when your current work reaches fruition?
So if you can imagine 10 years from now, or even sooner, this idea of generative health. We'll all have our own AI chatbot that knows our genome, our digitome, our sociome, our metabolome, can kind of build a portrait of where we are.
I need to understand more about some of these. Go back through a few of those. Digitome?
Digitome. So like my smart ring is streaming data about my stress and my heart rate and my oxygenation, maybe my blood pressure. My voice can be a biomarker. I can have my base genomics understood at low cost. The microbiome on your skin and your gut, your metabolomics. You can do a real-time continuous glucose monitor soon in your Apple Watch or other wearable. It's no one piece of data that's interesting. It's when we map it together. And we can use that to almost be a Google Maps or Waze for your health, learning from thousands and millions of other people like you, and hopefully giving you sort of early guidance and keeping you on a healthcare journey rather than a sick care journey. So I think in the next decade, we'll start to see that technology meld and be real-time and optimized to each of us.
Yeah, amazing. So that's a glimpse of your work. Why don't we just continue just briefly, and then we'll bring in our first sort of round of questions. But on the positive flow of this conversation, give us some more. This can be possible. This should be possible. Just help us understand where health and medicine is going.
Well, I'm an oncologist by background. A lot of patients present late stage with a heart attack or stroke or cancer. So we have a very intermittent and reactive sick care model. Usually only get your vitals and labs checked at 0.001% of the time in the clinic or the emergency. The near future is continuous data. And again, giving you insights to that and engagement as a human to be much more continuous with your data, much more personalized, proactive, preventative, and to bring care anytime, anywhere, arguably at lower cost with better outcomes. And the pandemic, which has been a huge stressor, often has catalyzed new forms of telemedicine, new mRNA vaccines, not just for COVID, but for Alzheimer's and cancer. So I think the art of the possible is already here. It's about unlocking those possibilities, and the minds at CogX are often those that can come together to solve for it.
Got it. So much for the yes and. Where do we need to be careful?
So there's a lot of powers we've talked about in big data and AI. It can learn a lot about you. The camera on your smartphone now or laptop can pick up your vital signs. It can communicate your stress levels if you're on a Zoom. Your digital exhaust can tell a lot about your health. And so the question, who owns that data? How do we smartly share our health data within the NHS or beyond to have a building that Google Maps or Waze for healthcare, but also enable privacy? How do we leverage the power of genomics, not just to understand your risks, but to enable smart gene therapy, but maybe not the CRISPR baby of the Gattaca world that some of you might be familiar with. So lots of ethical challenges, and often the technology, like ChatGPT, is moving faster than regulation, ethics, and policy can keep up with.
Yeah, well, I know that we're going to pull on some of those threads. Can I ask you quite a personal question?
Please.
How long do you hope to live for?
I think a lot of folks, I come from Silicon Valley, they want to live forever. That's a very long time. I think the question is more about health span than just lifespan. An example is my wife's grandmother just turned 104. We were 104th birthday, 100th birthday. She doesn't just have good genes and maybe didn't smoke, but also the social determinants of aging and community have helped her live a long, healthy life. So if you want to be 100, why do you want to be 100? I like to be maybe 120, but still functional and thinking, have a sense of purpose, community. You don't want to be just stuck there being alive. So I think what's exciting in this era is if you watch your sleep and your diet and your exercise and your social connection, next 20 years are going to start to see us unlocking the ability to stop and reverse aging. Yeah. So stay healthy, optimize the basics today, and I hope, like many of us in the room, to be 100 plus.
Here's to that. Right, and I know you've got colleagues from the Singularity University here. Who will open the bidding with a question for Daniel? I see you there, sir. Welcome. One of the best dressed guests at CogX this year. But stand by, because I want to just get a better picture of who's got our initial raft of questions. Noted. Who will raise your hand? I'm looking. I think I'm looking for others. Let's go. I'm going to come down to the lovely green chair, but I'm going to start at the bar and work my way forward, if that's all right. Unless you were saying hello to me, in which case this is going to be really awkward.
I was saying hello, but I'm also happy to ask a question. I'm Dr. Mandeep Rai from the Values Compass. I wanted to know whether there was one challenge that hasn't yet been discussed, because in many ways it feels as though people can become quite philosophical, and yet we don't have any answers. I'm just wondering whether there's something that you've thought of that perhaps we haven't discussed, and where there might even be an answer.
Haven't discussed? Mandeep, are you hinting at taboos here,
yes,
or just undiscussed? Okay.
That's a great question, broad one. I mean, what haven't discussed is with all these new technologies, what is it to live a long, healthy life? When do we retire? What does it mean to be 120? And what are the ethics of, how do you design society? Or do we send everyone to Mars? There's also all the power now of not just reading your genome, but writing to your genome. I was recently with some of the leaders in genetic engineering. The question is, when do we start to select and modify our children at the IVF stage? And what are the ethics and implications of that? Because you could start designing in and out aging genes or genes for intelligence or preventing disease. So there's lots of elements in the biology ethics space that are philosophical but are now becoming real faster than we're addressing them. And sometimes art and science, movies like Gattaca and others I've met people creating those future modalities, open up our art and our mind to the art of the possible and the challenges.
There was such affection in this stage earlier between Ez Devlin, award-winning designer, and Dame Wendy Hall, scientist, professor, and it was such an interesting STEAM sort of meeting of minds, actually, I must say. Thank you, Mandeep. Sir, please, welcome. And by the way, anyone, feel free to say who you are, but you're not expected to.
My name is Jose Cordero. I'm also founding faculty of Singularity University with Daniel Kraft, but I was in energy. Now I am more into biotech. And the founder, Ray Kurzweil, just sent me the manuscript of his coming book. I don't know if he has sent it to you as well. The Singularity is Nearer. And he talks about 2 dates. He talks about longevity escape velocity by 2029 to 2030. That means if we make it to 2030, we will live long enough to live forever, but still aging until 2045, when we will be able to rejuvenate people. Those 2 dates are in the book that comes out next May. The Singularity is Nearer. So what do you think about longevity escape velocity by 2030 and rejuvenation technologies by 2045?
Right, great question. Our friend Ray Kurzweil is quite a good predictor. This idea of escape velocity, just to remind folks, is that if you are staying healthy and preventative for the next 10, 20 years, some of these technologies are going to come into play. It might be if you need an organ transplant, we can do a genetically modified pig organ, which has already started to happen, to give you a heart transplant when you're on the waiting list. It might be using new abilities to reprogram stem cells in your body to do rejuvenative therapies instead of replacing organs or stem cells. And the future is coming faster than we think. 2029 is not that far away. I don't know if I'll reflect on the date, but some of these things are going to become available. The question is also who gets them, who benefits, and at what stage of life. So that's one. What was the second part of the age?
Rejuvenation technology.
Yeah.
2045.
This rejuvenation idea is that aging and disease, is it either treating a trauma, a disease, or just aging? And can we start to understand that clock and start to reverse it? And that's starting to happen in animal models, from nematodes to mice. The challenge is translating those into human trials. How do you do a trial of longevity? What's the clinical endpoint? It's a long trial to wait 30 years for that. So there's lots of challenges. There'll be a new X Prize that I'm involved in HealthSpan. And we're going to start to see new thinking come together. It's not going to be any one drug or gene therapy that extends health span. It's going to be a combination.
So by the way, on that, and Jose, let's hear your answer to your own question or raise predictions. Well, how do you feel about those?
Well, I totally believe that by 2030, we will reach longevity escape velocity, and by 2045, we will rejuvenate everybody. In fact, that is the subject of my global bestseller, The Death of Death. But, so I agree with Ray Kurzweil, but that brought another question. I imagine that you know that the X Prize Foundation will launch a longevity prize in 2 months in Saudi Arabia, $101 million. What do you think about it? How much do you know about it?
I know enough. I've been leading the X Prize for the Health and Pandemic Alliance and coming up with new health X Prize ideas. And just those of you on a quick element on prizes, you can prize something. Like we did a medical tricorder X Prize 10 years ago to stimulate new thinking for diagnostics. We ran a rapid COVID testing X Prize. This X Prize is trying to catalyze, it's going to be a health span prize to see if new solutions can start to reverse aging, and how do you measure that is still a challenge. Yeah. So I think there's lots of possibilities.
Yeah. Now, I'm very conscious, Daniel, we can sort of explore this so much. I want to get more questions in. I see in the front row, but first of all, very patient, just in the waistcoat here. Thank you. I think it's waistcoat. Thanks.
Hiya, my name is Baz Carter. I'm from Newton Health and Social Care Consultancy. It might be from a point of ignorance, but it feels like a lot of the focus on digital health is focused on physical health. And I was wondering what your thoughts were on some of the main advantages coming up in more holistic health? So thinking about social and mental health as well as physical.
Yeah, I mean, most of our health is derived from our social determinants of health, where you live, who you're connected to, not fancy technologies like gene editing and stem cells. And so there's a real opportunity to leverage some of these new digital tools to connect folks who are lonely, or to use voice as a biomarker to detect depression. There's a whole new set of tools in digital mental health. Some have been pioneered here in the NHS in the UK that can sometimes be a chatbot for managing depression, or now combining with psychedelics. There's a lot of new elements in focus, because we realize that most of our downstream diseases are driven by social elements. And if we can get upfront about that and pay for prevention and health, we'll save on the sick care side of the equation.
And so, well, let me seal my lips. I want to get more questions in. Well, here we are. Why not both of you, actually? Do you mind just taking a pair of questions?
Hi, I'm Nicole Yashin. Mine is an educational thing. It's a tiny bit long-winded. I did a research project for Harper University, because vets were the 4th highest suicide rate. So doctors, dentists, police officers, and then vets. And they couldn't understand, because they're trained...
Forgive me. Do you mean veterinary surgeons or
yes,
army veterans?
Veterinary surgeons.
Right.
Animals.
Yeah, got it.
The students go through 5 years worth of training how to save an animal. So the research that I was doing was looking at human as tech, and I was looking at biohacking, cyborgism, but then I started to look much more at Temescal sweat lodges, or rituals, or yoga, or all of these other ancient things that then that brings me back to my question about education. How are we educating? I mean, my research was good for Harper because it meant that they could start to put in a different semester of learning that was much more about understanding the human as the tech. How far are you going with that?
Well, that's a great question. I mean, whether it's a veterinary surgeon or a medic or a nurse, we've all been through a pandemic, and burnout was bad before, often for the stressors of how we have to deal with medical records and electronics rather than the patient or the animal, including the human-animal interface is really good for your health. I think we're starting to educate more self-care, whether it's teaching kids when they're young mindfulness training, or to make a medic or medical
I'm not sure they're doing that in the British syllabus, but...
It's not ingrained yet, but this idea of resiliency for mental health and beyond. How do you vaccinate against mental health issues? How do you train folks to ask for help? How do you debrief in a hospital after a traumatic death that can cause PTSD and the nursing staff, for example? So I think it's more recognized, but there's a long, long way to go, and there's a lot of still taboos. But we're starting to think more proactively about that in many health systems, but it's still quite broken. Yeah.
Really interesting question. Thank you. Next door. Thank you.
Hello, Suki Fuller. It seems somewhat elitist. I always have this problem working in tech, and especially my background in intelligence, the national security arm, is that we have these discussions when we're speaking about how technology is going to be moving and rapidly forward. And here we are speaking about medicine and science in that regards of health. And I'm wondering how this is going to function for the part of the world that does not have even access to 2G, let alone anything. And it's highly frustrating for me that we are moving so rapidly. And the gentleman over there talking about 2045, and like, we haven't even figured out how to help people live beyond the age of 6 in some countries.
Sure. Yeah, I'm with you that we need to expand health equity and access to all before we maybe focus on supercentenarians, and has interest. But the opportunity is to democratize some healthcare. 2G is, yes, many parts of rural California, where I come from, don't have good internet access, and we're getting satellite comms to the 50% of the population that doesn't have high-speed internet, and that opens up this sort of digital divide, the digital determinants of health. And the poorest on the planet all have SMS phones and soon smartphones, and that gives them a new conduit to have an AI chatbot doctor that's rolling out in India and China and rural Africa, sometimes leapfrogging the Western nations because you could do things differently. So I think that some of these digital tools, including internet access, can really give better access for a community health worker in a rural village to do a diagnostic. You can have a pocket ultrasound powered by AI, the imaging, or these things can come together. So there's the huge opportunity to apply it to sort of the underserved populations. And we are going to see sort of the digital divide hopefully narrow and address helping kids live and survive rather than focusing just on getting folks to 120.
Yeah, great questions, Suki. Come back in if you like.
Okay. No, that's all great, fine and dandy. Sounds good. Unfortunately, we know money talks. And that's the next end of my question is about the connectivity. I've done a talk where I talk about everything's connected and how when you are connecting, say, your mental health records to your physical health records to your music choices. When Spotify did their project and they were, we'd be able to tell you, how you're going to feel because this is what music you're going to listen to. And, this is also your mental aptitude and your blood pressure, all those things. The biggest problem I find is, one, the privacy aspect, and two, who does own that data? There was a story a few years ago of a woman who had a heart machine and she wanted the data. She was a data scientist. She wanted the data because she said, that's a false reading. I didn't have a heart attack.
Right.
They
Challenging.
would not give it to her.
Challenging. Forgive me, Dan. I'm going to just pause us there because rather than, because we've got 6 minutes remaining. Thank you, Suki. Let me see other questions in the space. There you go, just on the back row. And I'm looking around the whole room as well. Please.
Hi, Remy Kesarani from Cadmus Capital. We do deep tech investments. Question for you about the regulator. How much of the way they operate right now is a bottleneck for all this innovation coming to market?
Yeah,
I want to draw on an experience I had with fintech, and specifically the UK regulator created the sandbox. It's
the
a
FCA
test environment. Of course, ethics come in when we talk about health, but do you see evidence of progressive thinking when it comes to the regulator, and is there an equivalent of a sandbox in the health world?
Yeah, it's a great question because you want therapies, whether it's a digital therapeutic or a drug or a vaccine that's safe and effective, but you don't want to wait 10 years for the trial when delaying the drug or the result can prevent lives from being saved. So the example in the US, the FDA, they are getting on the curve of digital. They have something now, the software is a medical device, because many things used to be just a drug or a device, and now the software has AI, needs to be updated. How do you regulate that? So they now sped up the pathways for digital therapeutics or AI for radiology. It's still not as fast as we might need, but it is improving. The whole pathway of sending in trials on PDF is now becoming digitized, and AI can accelerate that. But it's still a bottleneck, and many regulators, their incentives are to say no, and they don't get rewarded for saying yes. At the same time, clinical trials can get smarter. Around this age of digital trials, where your wearables and otherables can be enabling anyone to enter a clinical trial and not have to come to the central hospital. So there is a big need to educate the regulators, which are often driven by, in the US, the Congress, which are not educated about some of these emerging tech, because it is a bottleneck and needs to emerge and accelerate along with the amazing healthcare technologies.
So I see another great question. Right on the back row there. Thank you very much.
Thank you very much. It sounds really optimistic and fascinating. And I want to ask you the question in the specific area of mental health, whether you're optimistic, and I just to cite, there was a great book by Daniel Bergner, The Mind and the Moon, which paraphrased Kennedy, who gave an optimistic speech saying and forecasting that very soon the mankind will reach the moon, and indeed that happened, and that we're going to solve all the problems of our mind. That hasn't happened 50 years later. So with everything that we know, there is huge acceleration right now. Do you see the signs of potential breakthrough in our understanding of our own minds?
That's a great. The mind is almost the final frontier, and there's lots of moonshots, including in mental health. But the challenge is we're still often practicing mental health in old rubrics. This DMC-4. What is depression or anxiety or autism? There are often many different diseases that have different biologic undertones. But there's this new era of almost precision psychiatry. We can image the brain. We can look at your pharmacogenetics, the biomarkers of voice. Instead of tracking depression by a survey, it can be from your digital biomarkers in other realms. So there's a lot to unlock there. I think part of it is being more proactive, finding folks at risk early and not waiting for advanced disease, giving folks the tools, whether it's a digital chatbot or access to a human in person or telemedicine or social constructs that can address that. But it is an exciting era in neuroscience to understand the underpinnings of mental health challenges, also human thriving. So how do we upskill our brains to be smarter and happier? And that's a huge area of opportunity, but lots of challenges are in our old mindsets, not our new ones.
So, Daniel, one thing maybe others have been struggling on this, we know how important social connection is to our mental health and well-being. And yet it does tend to be, I've got the answer, let's create a personal AI, or indeed, let me find some tech to connect you to a clinician. What about tech to connect you with another side-by-side human being? Who does that? Why aren't more people doing that? Isn't that the healthier alternative?
Yeah, and part of it is how we design society or our schools or our workplaces, sometimes to build that social connection into the workroom or the lunchroom to stimulate the face-to-face. I mean, it's good to have some Facebook, but folks who are on more Facebook may be lonelier than those who have real-time elements. And we know that social isolation is more dangerous than smoking. So I think part of it's design thinking and also the mindset of how we engage in our not just the chatbot, but our human components. Yeah.
So as you look for your next wave of collaborators, who would you like to work more with? What sort of organization or individual?
Well, sometimes it's this idea of, patient included. All of us have seen or had personal or family or friend health challenges, and we can now say, why are we still using fax machines? Why are we still tracking mental health on a survey? Many of technologists here have incredible mindsets and platforms to think, how might I plug that into healthcare? And not just to think about where we are in 2023, but be like Wayne Gretzky and skate to where we're going to be in 2033, that 10-year vision, and to apply your energy, your mindsets, and collaborate with the medics and the biopharmas and the med device folks to create those solutions. Sometimes it's an app, sometimes it's an app, wearable, sometimes it's
So what's your advice then on this? Because this is what we need to understand, because Wayne Gretzky said, I skate to where the puck is going. Well, we don't know where the future's going to be. So we could be wasting our time. So how are we smart and long-termist?
Someone is like having that vision of what's possible in 10 years or less. How do we want to emphasize health? How do we align the incentives? NHS has challenges, but the US, we're very much paying for fee-for-service. The incentive are to keep the hospitals full and to have more diabetics in some realms. So I think we need to be painting a picture of health and not sick care. That's more continuous, proactive, personalized, anytime, anywhere, intelligent, crowdsourced, and can democratize health access and equity around the planet.
This is fascinating. I want sort of another hour on this, but we haven't got it. Are there other strong questions in the room? I see there, I'm just looking out, my final, it's like lots at auction. I've sold lots for less than this. Can we go back row and then just here, gentleman in the jacket? Thank you.
Hi, Daniel. It's Tina Woods. So we ran a session yesterday called Longevity from Cells to Cities, and I'm really interested in this whole, how do we connect mind with body and create environments for human flourishing? So we talk a lot about apps, drugs. How do we create environments, and I'm talking right through communities, homes, cities, where we can use tech, where we're really trying to make life as good as possible for all, because our social connectivity, all the things that we're hearing about in the Netflix blue zones, it comes down to very simple things and making environments where we can make the right decisions easily, cheaply, where we feel good. So that's my question.
Blue zones.
How do we dismantle the incentive?
Blue zones where people live a lot longer, right?
Well, that comes to even being, the blue zone lessons of social connection and movement and respecting elders and some diet and purpose is trying to be designed into some new places, and with variable success. But that means if you're building a new street and you think about the places where people can meet, the green spaces, the places where older and younger folks can mix and have social connection and feel senses of purposes, how you train kids. I'll put on my pediatrics hat. How do you give them the right diets and start in life that give them that ability to have a long health span and live to 120 plus? A lot of that is about design thinking and thinking about not the sick care model, but health as something that we're engaged in continuously, because most of us don't think about it till we have a problem and the red light goes on. And I think there's opportunities to engage everybody in society to be part of that solution.
Fascinating. I wish I'd been at your session as well. I'd love to talk to you more about that. Thank you. Question just here. Thank you.
My question is more around the business model. How can we better align our own health goals with the incentives of the healthcare industry that's so hooked on the recurring subscription across everything, whether that's pharma to hospitals, etc.? Have you seen any innovation on the business model side so far, or where would you like to see or hope to see the business model innovation?
Yeah, sometimes we go back, we talked about East meets West. Sometimes old traditions are good. I think in China, the physician used to get paid when their patients were healthy, not when they were sick. And so there's all about, in the US, we have fee-for-service moving to value-based care. You pay for prevention and keeping people out of the hospital. So it's often about these misaligned incentive models. You know, the physician who gets paid to do more biopsies and procedures and transplants will do those. They're not going to pay to manage your hypertension and keep your diabetes from ever evolving. So some of it, particularly in systems like the NHS, can be aligned with paying for wellness and prevention and saving dollars later. So it's all about where the dollars flow. And in many places, in the US, for example, there's hundreds of dysfunctional healthcare systems. And most of those work on the sick care model. So sometimes it comes down maybe to the individual being incentivized as well to see that they might live to 120 and have those connections. And also to reward those businesses that are on the prevention and wellness side. We've seen, I think I saw the founder of Calm here, right? Those are
two founders, Michael and Alex,
right
yesterday. Yeah.
Right, mindfulness practices can extend your brain span and help maybe prevent dementia. The social connection is so important. But also, maybe paying for the next generation of vaccines that will prevent the cancer and screen your child before they're born with their genomics to understand their risk factors and, you know, spend $1,000 early and save $100,000 in years of life later. So very complicated. And again, there's no one system around the world. We need to cross-fertilize and learn from the blue zones to the socialized medicine systems to the fee-for-service and combine forces.
So what's an example, Daniel, of, we're getting to just five minutes remaining. So if you've got a final question, do say now, please. But I wonder in the next few years whether there are some names that we're already very familiar with that will become associated with health in a way that they're not today. Any predictions on the sort of names or organizations that might be?
I mean, we have well-known folks who've changed dramatically. Like Jeff Bezos was the scrawny tech geek, and now he looks like a little more buff, and I think he's taken care of by a famous longevity physician. But those sorts of folks sometimes are in the press and can inspire. Like, wow, he changed dramatically, and not with steroids, probably with good sleep, diet, exercise.
But I'm thinking organizationally. So today, and forgive my ignorance, I wouldn't traditionally associate, one might not traditionally associate Amazon with health, but perhaps in 5 years we will.
Well, we know that Amazon, Apple, Meta, they're all getting in healthcare. I mean, Apple, next generation wearables from them are likely to be able to do real-time blood sugar and blood pressure just from your watch. And so part of this future will be, depending on who owns it, and privacy issues are definitely a concern, streaming your digital exhaust continuously, looking at that with your smart AI doctor.
So who will be the big, powerful players in this? Any others to watch?
Well, the consumer folks, like the Amazons, they understand behavior and consumerism. They are getting into healthcare services as well with a platform called One Medical. They're now shipping drugs and pill packs. So I'm trying to think of others in the space.
Well, I don't want to lead the witness, but what about in financial services? MasterCard takes on health. I mean, people who have our trust already.
Well, sure, and we know that the number one cause of least financial disability and bankruptcy in the U.S. is healthcare issues, that in the U.S. at least. And financial health, sexual health, social health, all are interconnected. And we often need to save for a longer life. So what are the financial elements if you need to have another 20 years of retirement? You're going to get lived under in 10. So all these things play together, and so I think big picture, thinking of financial, we almost want a FICO score for our health to understand, health not just as your labs or your vitals, but an integration of the elements. So maybe it's simplified so you can get that score like your credit score and improve it over time and be incentivized to do that. Maybe you get a lower health insurance premium or better benefits.
Experian for health. I like it. Interesting. I see you right on the front row here. And alas, it will be our final question. Thank you.
Thanks. Hi, I'm Grace. I used to work for IBM Watson and a cardio AI firm. I'd just like to carry on from what you said about the dysfunction, and understandably there's the different procurement systems in the US, there's the mismatched IT systems in the UK, there are mental barriers for people not ready, there's lack of maturity in the technology of a lot of entities right at the moment. What do you think is the biggest dysfunction and barrier for us to get through to implement good IT, good AI?
Yeah, the big challenge is often called interoperability. That's the buzzword, where you have these data silos. It could be your genomic information and your radiology and your electronic medical record systems that don't connect from one hospital or one region to another. And we are in this era of creating massive amounts of data, but that's a so what. No doctor or patient wants all this data. They want actionable insights and information. then they can narrow the gap to making that useful at the bedside of the website, or something you can do for self-care, or your oncologist can do to do precise oncology. So there's also misaligned incentives in sharing and connecting those dots. So some of it has to come from the regulatory and government levels to make sure that the data is shared and it becomes available. The examples in the COVID pandemic, what used to take 10 years happen in sometimes 10 months or 10 weeks in terms of learning and speeding up trials and knowledge sharing. So sometimes an emergency can stimulate that. We also need to see that collaborating in those ways, opening up data, making it available, opting in when available, being mindful of privacy, using technologies like blockchain to share in anonymized ways can really unlock this era of real-time learning in a global healthcare system that's much faster and saves lives and optimizes health, not just disease care.
I see a good example in Scotland because, of course, they have they've captured everybody's details, the diagnostic tests and everybody's medical history.
This is in Scotland, by the way, if you're tuning in. Sorry.
At the ready for everything to be processed and used, the data to be used, I suppose. So they, I think, are ahead of everybody else because through the consolidations in England and Wales, it's been all about politics and you can't change people. And
So on that, Grace, these are great points. So I know we've mentioned the UK, the US quite a lot. Anywhere else where we should be turning our minds for the future of health?
Yeah.
We go on a sort of virtual trade mission now.
I've just been talking to folks in India who, there's a lot of disparity in access. Up to 1 billion folks have almost no access to a primary care doctor or nurse. They're wanting to build not just the AI doctor, but more of a co-pilot for care to build these next generations of systems with new mindsets, and they don't have the regulatory constraints of other parts of the world in some cases. So we're going to learn how to do things smarter from sometimes other locations. And speaking of Scotland, in many places we're still using very limited data sets. If you feed just white Caucasian Europeans into a data set, you're not going to build health equity. And there's now platforms in the UK and the US trying to learn from much more disparate communities and build learning engines that will improve health for all.
Daniel, look, two thanks for your time today and for your work in the world. We are massively grateful on behalf of everyone here at CogX. Thank you to Daniel Kraft.
Thanks, everybody.